All right. So welcome students to this. Dr. Joshua, am I audible?
Sir, yes, sir, you're audible.
All right. So welcome Dr. Joshua, Squadron Leader Joshua, to this webinar. Thank you for agreeing for having this session for our aspirants who wants to join you in Army Dental Corps,
Sure.
where you are posted right now. So everyone, please welcome Squadron Leader Dr. Joshua Nirmal Kumar, who is currently a dental officer in Indian Air Force. He has done his undergraduation from Government Dental College, Chennai, after which he cleared NEET MDS, and through that he joined into Army Dental Corps, following which he appeared for NEET MDS exam, which he cleared, and then he got into post-graduation. He has done his post-graduation from Army Dental Center Research and Referral in prosthodontics, if I'm correct, right, Dr.
Yes,
Joshua?
sir. Yes, sir. Yes, sir.
And so we are lucky that we have someone with this vast experience in this field who has come here to guide us. So let's all attend this. First, he'll give us the basic idea about the points that we are told that what all things that you need to know, or we can say all that you need to know about the Army Dental Corps. We'll be discussing about the interview and the selection process, what will be the medical fitness criteria. Uh, Once you're selected, what will be your duties there, how your training will be, what are the scopes and futures prospectus in this field, and also if you have any doubts in the later part of this session, you can raise your hand and we can discuss your doubts as well. All right. uh, Dr. Joshua, Squadron Leader Joshua, will
Sir.
be talking about these points, and students, I'll request you to have a pen and paper with you so you can point out the like the whatever things that he's telling you, and at the end, if you have any doubts, please raise your hand. You'll be able to ask your doubts. Okay. So handing over to you, Joshua.
So, thank you so much for the very brief introduction, sir. So, at this moment, I would like to thank you, Dr. Bomik, sir, because I myself he being my senior in my college, and also I myself was a student in APIRE MDS, and I feel proud to be called to give this guest lecture in the same forum where I was a student once. So I would cover my lecture in the following headings, which was already mentioned by Bomik sir. So starting with the introduction, like working in the Indian Army or serving for the nation is always a pride, and it's always a prestigious part of everyone's life. And and even these days, many people are aware about the Army Dental Corps. So people, they wanted to join here so that they can both serve the nation and also their professional skills get upgraded, and they also try get a chance to serve different parts of the country. So starting with the interview, I hope it is between November 7 to 17. So for this year, there is a vacancy of around 30 dental officers. So depending on the vacancies, around 300 candidates will be called for the interview process, and interview will be for a period of 10 days. So like there will be 30 participants per day. So like example, if today they have conducted interview for 30 participants, and the participants who are selected or cleared the interview, they will be taken for medical fitness on the next day. So the steps to enter the Army Dental Corps or to get selected are: first there will be selection, that is based on your NEET rank and or the NEET score. Your name will be selected only for the interview. After that, there is no the NEET score won't be considered at all. So this NEET score and NEET ranks is only used for shortlisting you for the army interview. And next, you straight away go to the step two, that is the army interview portion. So in army interview, generally it is held at Delhi, that is Army Dental Center Research and Referral, that is present near Dholakwa, New Delhi. So the interview will be from morning till evening. So it will happen with a panel of officers sitting in front of you. So the panel of officers will be around 8 to 10 people of different departments, right from Army, Air Force, and Navy. You can expect both medical, dental, and as well as non-medical people also conducting the interview. And the type of questions that they might ask, can be of varied types. We can't be like specific. We can't expect any specific questions like they might ask only about dentistry or only about medical field or only clinical questions, nothing like that. So they basically test your presence of mind and also how quick you give the answers within a short period of time. And they can also put you in a certain situation, like suppose they might give you a situation that you have got two close friends. One of the friend was in both were in trouble, and whom would you like to help and why, or how do you manage the situation, like such such kind of questions. And also they would ask what of your hobby, or they would also ask you some questions related to your hobby. They can also ask about current affairs. They can also ask about politics. And since artificial intelligence is playing a major role in dentistry and in all fields, they can also ask you about questions regarding artificial intelligence and everything. And yes, there will be questions on dentistry, but you please don't expect questions only from dentistry. So they can ask any questions regarding regarding anything. Like they can even test your gender knowledge, or they can even test your interest in sports, interest in cultural activities, or how good you are with friends, or how socialized you are. So they can test whatever they want. So you please be prepared for the interview. So the night before interview, please have good night's sleep so that you are vigilant and your brain is always active. And also, whenever you go for the interview, they will notice each and everything, the way you enter the door and the way you sit and the way you are dressed up and the way you answer the questions, and also the way you give response for each and every questions. And also, obviously, we won't be able to answer all the questions. So there is a certain way to say that you don't know the answer. So like bluntly, you can't say them, I don't know the answer. So there are certain ways to tell that you are not aware of the answer, or you are not able to recollect the answer. Sorry, sir, I will get back to you. Sorry, sir, I went through this, but I'm not able to remember it now. So there are certain phrases which you can use to say that you don't know to answer, or you don't know the answer for the particular question. And also regarding the dressing which you do for boys, it is generally advisable to go with a light shade shirt with a dark pant with proper formals provided with a tie and everything. And for girls, it can be an for formal salwar suit, or even they can go with a pant and shirt. So the dress up and the way you present for the interview yourself, it matters a lot. So the first impression which you create as soon as the panel sees you, that is more important. And depending on that, they will ask you different questions. And also specialist officers who are in this lecture, you should be aware of your thesis and whatever your topic of interest in that particular lecture. Example, if you are a prosthodontist, and there will be a prosthodontist sitting in that panel, so he will be keen to know your interest in the field of prosthodontist, like particular interest, whether it is maxillofacial or whether it is implant. And same way, if there are any surgery pieces over here, so even they will try to know which field you are more interested, so that accordingly they will take ask ask you the question. So please be smart enough, and also you should be clever enough, so that you should try to drag them through the field where you are more familiar and where you are more confident to answer all the questions. And then regarding current affairs and general knowledge and everything, so please be aware of our army chief, air force chief, navy chief, and the present defense minister, and etc. Like you should know the basic things which are happens in our country. And rest there'll be you be whatever the answer you are telling, you we should never bluff about the answer which you are telling. If you know the answer, please tell short, crisp answers, and your eye contact should be onto the person who asked the question. Suppose if the person on your left asked the question, your eye contact should be onto that particular person, and then you should answer for that question. And similar way, once that question is done, whenever the person asks for the next question, you should look at that person, and then you should answer the next question. So once this is done, all your answers should be short and crisp, so that they are happy with the way you present yourself and also the way you answer all the questions. Suppose if you are not able to continue, or if you feel you are stuck up whenever you're answering any questions, you can frankly tell them, sorry sir, I don't know, because they just check how strong you are with your decision, and also how brave you are with all the decision which you take. Here you don't come as only as a dentist, but also as a Indian Army officer. So there will be a group of men who will be working under you. So they will be seeing your confidence, your courage, your bravery, and also how smart you are in answering all the questions. Questions can be of anything. You might think these questions are asked only for kids or only school going people. No, they will check your patience, they will check they will try to check you in all aspects. So these are the points which you should remember regarding the interview process. That is the way you are dressed up, the way you present yourself, and the way you answer. And regarding language, if you know Hindi, it is fine, you can go ahead. If you don't know Hindi, you should be confident with your with English. Because when I went for the interview, I was not knowing Hindi, so I answered all the questions only in English. So the language you see which you use, that doesn't matter. So whatever you talk, you should be clear with your answers. Take a time, take a pause for a couple of seconds, and then you can go ahead with the answering of the questions. And next, once interview is done, like example, if the interview gets over today, at the end of the day they will call out the name of the participants who have cleared the interview. That those particular people who have cleared the interview, they will undergo for medical test the next day. So in medicals, they'll be checking everything from head to toe. So make sure you are in proper height, you are in proper BMI, and your BMI is properly maintained. And they'll be checking your chest X-ray. They'll be checking your blood test, that is CBC, HB, and everything. And also they'll be checking your cholesterol level. Plus they'll be checking your USG, that is ultrasonography. So make sure you are like, they will not be asking you to run or do anything. So they will just have your basic medical examination checked. So right from ear, eyes, nose, dental, your chest X-ray, your bones, your feet, your soul. There shouldn't be any flat foot or something, and there shouldn't be any bent elbow. There shouldn't be any maximum of septal deviation. So these are the basic things which is there is a criteria in Indian Army which should be followed, and that those criteria should be met. So they will be checking in that particular criteria from head to toe for both boys and girls. So please be prepared for that, because there are certain situations where they give temporary rejection. Like suppose if I have lots of earwax, or if I have lots of calculus, or if the teeth used to be must be restored. So I'll be considered for the merit list, but I'll be under temporary rejection, which means they will be giving a period of around 6 weeks or 42 days. So within that 42 days, I have to get that particular condition rectified. I should go for scaling, or I should go for removal of the earwax, and then I should report to the nearest military hospital of your particular state, and then you will be again considered as fit. So there are certain conditions which are considered as a temporary rejection, which can be rectified, and still you will be considered for the merit list. But there are also certain conditions that can lead to permanent rejection. Like there can be flat foot, or there can be bent elbows, or there can be knocked knees, which can't be corrected through surgeries, or which can't be corrected with the span of 42 days. So those are permanently rejected. So those candidates will be sent out from the medical examination. So actually those are not in our control. Like those are not in our hands. So some people will be able will find any disability or any problem in their body only at the time of their medical examination. So there have been many candidates who came to know that they had a problem in their kidney, or problem in their liver only when they underwent medical examination for joining Army Dental Corps. So those things are beyond our limits actually. So please be well prepared for the interview, and try to keep your BMI within the normal limit, so that there are any gross, like if your height is around 155, and if your weight is more than 70 kgs, then which means there is a gross derangement in their BMI. So that shouldn't be the case. So that will go for straight away, they will reject you, or they will again give you a time of 42 days and ask you to reduce around 20-25 kgs, which is very difficult to reduce actually. So if you are planning to join army, and now we have got almost 2 weeks time, so you can straight away start preparing accordingly for the medical examination. And then regarding the once medical examination is done, then you will be considered for the merit list. So this year the number of vacancies are around 30 seats. So the merit list will be out. So the first 30 people will be getting their postings through email, and also they will be sending a hard copy via speed post to your home, the address which you have mentioned. And whenever you fill the form after reaching that, please make sure your contact number, your address, your NOK, that is next of kin's contact number, either your dad or mom or brother, who was the number you are giving. So please write it legibly, so that if you once you get selected, the letter which comes to your address are sent to the right place, and there are no any problems because of our silly mistakes. And then the phone number which you mentioned should be phone number as well as mail ID should be properly mentioned with all the alphabets as well as small letters wherever it is necessary. And then next commit, once the merit list is out, the first 30 candidates will be given the posting orders, and they will be given a particular date to join that particular unit or places. So once you go there, so you can't expect all your first postings to be nearby your home. So there can be postings even far away from home, or there can be some field areas where it is a little uh, difficult to access and connect over there. So postings, it will be from the headquarters Delhi area. And then once the postings is over, so initially you will be getting commissioned in the rank of captain. So all dental officers who get commissioned initially, they get commissioned as short service officers. That is, for a total of 14 years you can work. Beyond that, you will be released out of service. So this 14 years, it is divided into three parts: 5 years plus 4 years, again plus 5 years. So after 5 years, you will get an extension, and after 9 years, again you will be getting an extension. So this is, I am talking only about short service commission. So initially, even when we all joined as short service officers. So which was for a period of 14 years. But after you complete 2 years of service, physical service, you will be considered for permanent commission. So to get the permanent commission, the exams are exactly like our final year BDS exam. You will be asked to perform class 2 filling or axe opening of molars plus chair side veva, extraction in surgery department, chair side veva, border molding or primary impression in prostho department and chair side veva. And then in perio, they will ask you spotters and scaling. In ortho, there will be spotters plus case discussion, diagnosis, and uh, giving the treatment plan for that particular case. So these are the criteria for examination that will be conducted when you appear for a permanent commission exam. So this permanent commission exam will be happening for a period of 5 days. So suppose if you clear the permanent commission exam, then you can work in the Army Dental Corps for a till you get retired or till your age gets 54 or 58. So this is the difference between short service commission and permanent commission. And one more advantage of getting permanent commission is that first advantage is that you'll be serving for a longer period, and once you retire, you'll be getting your pension. But whereas for short service officers, they work only for a period of 14 years. Yes, they will be getting a tag of ex-serviceman. Their kids will be dependent. You can get your treatment done through any army hospital. You can avail all the facilities of canteen card, but you won't be getting any pension. Plus, here when you plan to do your post graduation after joining army, there will be different priorities. So the first priority is always given for the officer who has taken a permanent commission, and next comes the short service officers. So that is the big advantage which you get once you clear your permanent commission. So once the permanent commission is cleared, then you are eligible for post graduation after a period of 4 years of physical service. That is, after commissioning a short service officer, after 2 years, you'll be eligible for permanent commission exam. Once you clear your permanent commission exam, after 2 years, you'll be eligible to appear to your NEET exam. So after you give your NEET MDS exam, and within the officers among army, they will be putting up a separate rank list, and through that rank list, you will be undergoing counseling, and then you will be taking the post graduation seat after 2 years of getting permanent commission. So this is the actual process till the time you join short service commission, you take permanent commission, and then you join post graduation. And for people who have already done post graduation, you will be straight away taken as captain, and the period of post graduation, that is 3 years, will be considered as antedate seniority. So you will be getting an antedate seniority of 3 years. Example, if you join this next year 2026, suppose if a candidate who have already completed MDS have joined in the year 2026, you get your antedate like 3 years ahead. So your antedate will be from 2023. So you'll be getting promoted to the rank of major or squadron leader. Major is in the Indian Army, squadron leader is in the Indian Air Force. So you get promoted to the next rank within a period of 1.5 years, because the antedate seniority of 3 years is already considered. And people who have done BDS and then when they join army, they will be getting promoted to the next rank after a period of 4.5 years. So that is the difference. When you finish BDS and you join, you go to your next rank. after 4.5 years. When you finish MDS and if you join, you will be getting your next rank after a period of 1.5 years. So that depends on your course, whether it is 3 years course or 6 months course. Even people who have done internship in bigger SRship in bigger institutes, if they are having their certificate, even they can claim their candidate seniority based on that certificate, depending on the duration of the period that was mentioned in the certificate. It can be either 6 months or 1 year or 2 years. So the maximum duration which candidate seniority can be taken is around 3 years. And next, coming into post graduation in armed forces. So compared to civil or outside, competition is very less, and also the branches we have only clinical branches. So in Delhi we have got 10 seats, and in Pune we have got 8 seats. So the branches available are prosto, perio, surgery, and ortho. So 4 departments, 4 seats each. So this sums up to 16 seats, combining both Delhi as well as Pune. And we have got 2 seats of endo in Army Dental Center, R&R, that is New Delhi. So there are total of 18 seats. So the number of candidates also will be only 18 or 20 candidates. So it's up to your rank, just decides to the which department you choose, but the seat is always assured. And next, coming to the duties. So once you get commissioned, you will reach the new unit, and then there you will be getting commissioned to the rank of captain. So once you get commissioned to the rank of captain, in the duties you should not expect that you will be doing only dental duties. And the same way, whenever a specialist gets commissioned, you should not think that being an orthodontist I will do only ortho work, being a prosthodontist I will be doing only prostho work. Because initially for few years of service you will be doing general dentistry in addition to your specialist dentistry. So you should be able to treat, or you should be confident enough to treat all the patients. And the same way, you will be also given other activities like other administrative duties. So administrative duties can be either like you can be officer in charge of any medical store, you can be officer in charge of sports, you can be officer in charge of any other, you can be food member, you can be a active participant in mess. So you can be given also other additional duties apart from being a doing your dental patients. So also you will be getting exposed to, you might get a chance to work along with the medical counterpart to in triage and casualty evacuation drills. So even in that there are particular or specific rules for all dental officers to get participated. And then regarding the training purpose, the training will be happening at once you get commission, after a period of 3 to 6 months you will be called to Lucknow, and there you will be getting your basic military training. So there you will teach, they will be teaching you, and they will be training you regarding running with weights, firing, climbing ropes, and all those things. And yes, you have to do once you get commission, you are a soldier. So you are a soldier first, and then you are a dentist. So you should fulfill all the criteria as a soldier first. So you should be physically fit, and in the meantime you should also be mentally strong, and also you should be professionally efficient to tackle all the things. So that is how army trains you both physically, mentally, and as well as professionally. You should be the best always. So the training happens in Lucknow, and once the basic military training gets over, you will be sent for basic dental training. So they will be teaching you about different dental rules and how what a dental officer does, and in different portions. Like, sorry, in places like Jammu and Kashmir or Arunachal Pradesh, those are called as field areas. So in field areas, as a dental officer, you'll be getting more of administrative job compared to your dentistry job. So there you'll be getting more of administrative job than your dental patient's job. So there the role as a dental officer will be totally different. So you should be tuned accordingly whenever you go for different places for postings. And then talking about your the well-being or any the advantages of being an army is that, so first thing is you will be a uniformed personnel and you will be a gazetted officer, and then obviously wearing that uniform itself gives you a much pride, and it is not a chance which is available available for everyone to go through. So that itself is a pride. And next thing, you will be treating the soldiers and as well as the Jawans and everyone who work for us in the border. And you get to meet all people over here, and you get to explore all different places with different cultures. And also you'll be getting a different, the dentists who are in the civil and dentists who are in the army, there is a wide difference in their work style and as well as in their physical fitness, and also how strong mentally they are. Because in army, when you are working, there will be a good work life balance, because the working time in army, it is around 8 o'clock in the morning till 2 o'clock. You will be seeing patients, and you will be called to office work if required in the evening, or if there are any emergency patients to be seen in the evening. Otherwise, the working time is only between 8 to 2 o'clock for the maximum of setups. Only in few teaching institutes, the working time is between 8 to 4 o'clock in the evening. So you'll be having better work-life balance. And the third advantage is that you will be considered as a serving officer. You'll be having different canteen facilities where you get all goods. Plus, you'll be having free access to all medical facilities for you and as well as for your dependents. And also, once you are and also for your kids in the future. And after all this, the getting post graduation in army is also a blessing, because people here we have all facilities, and the it is next to AIMS in Delhi. So all the equipments and all the futuristic equipments are all procured in army. So it is available in both Pune as well as Delhi. So getting a post graduation done here, you get exposed to all uh, recent as well as conventional methods of treatment, conventional modalities of treatment. So these are the main advantages that you must consider when you after joining army. And once regarding the interview process, so you should be always confident in whatever you answer. So, and again, if you have any doubts, you can ask me now, because these are the I have just said you a brief about all the processes which you will be which you can face or find in the army. And also I have briefed you about how the interview process will be, and what are questions you can expect, and how you should answer the question, and how you should present yourself to the interview. So these are the few points which you should be confident about, so that you can sail through the interview. So other than that, if you have any doubts, you all are free to ask me. Over to Bomik, sir.
Uh, Thank you very much, Squadron Leader Dr. Joshua. We have some questions from our students.
Sir.
Uh, uh, First of all, let's see those who have raised hand if they want to unmute and ask. So we have Shazia who has raised hand. Yes, Shazia, you can unmute and ask your question.
Hello, good evening, Doctor.
Yeah, good evening.
Thank you so much for this useful information. I have a doubt that I'm short of 2 centimeters in my height. Will I be eligible for this post or not?
What is your height?
149 centimeters.
149.
Yeah.
Okay, actually, I think 150 is the minimum height that is required. But for a centimeter, they should not. They should consider you actually. If only if there is very gross difference, then they will be uh, rejecting you.
I'm
Yeah.
okay. I'm 4 feet 10 inches actually. So
Actually, the centimeter mat, there is a separate height weight chart. You can look
hmm,
into the internet. So that they've
to
got.
be
Yeah.
yes, to be precise, I'm 149 centimeters, sir.
Yeah, that's what I'm telling. So there will be a separate height and weight chart. So if your BMI is right, you will be considered, because the height concession is given only for people from Northeast. There is a generalized concession for the people from Northeast, that if they are 2 or 3 centimeters shorter than the actual height, they will be considered. But for other part of
Hmm.
the country, you should follow that particular height weight chart. So please make sure your weight is within the normal limit. So you should be considered, because just a centimeter height there, only if there is any gross change, there are chances for it to get rejected. But 149 must be fine. You can go.
BMI
Please go
is
ahead.
normal.
Yeah.
BMI is within range, and weight
Yeah.
is also in within range. The height was only my doubt, sir.
No, no, no. You can go ahead. You can go ahead, please.
Okay, thank you. I hope, Shazia, your doubt is solved. All right. Okay, we have Dr. Vedika who wants
Sir.
to ask. Vedika, you can unmute and ask.
Okay. Hello, sir.
Yeah,
Good
hi.
evening, sir.
Yeah, good evening. Please ask. Tell me.
So my first question is, if I'm not getting through SSC Armed Forces this year, and if I get into a government dental seat, then for MDS, then after 3 years I have to give NEET exam again for
Yeah.
SSC.
Yeah. Yes, you have
Okay.
to. Because the NEET exam that was conducted in that particular year, only those score will be considered. Like example, you are giving your interview this year. So this year's NEET score will be considered. So you can't take this year's NEET score after a period of 3 years. So once you finish your MDS, again you have to appear for NEET MDS. And when you apply for NEET MDS, there will be an option over there that whether you're applying for post graduation, whether you're applying for to join the armed forces. So you should select that particular option. Second time when you give your NEET MDS exam.
And sir, how it is like decided that that I can I can apply for Air Force, Army, or Navy?
Yeah, it's a good question. Actually, even I was in the army for 4 years initially. So initially, whoever gets commissioned, they all will be commissioned only in Indian Army. You won't be given a choice. So all 30 who will be getting commissioned this year, who will be getting selected this year, they all will be getting commissioned as captains in Indian Army. Rest, depending on vacancies in Air Force and Navy, and based on your performances, they will be shifting you to Air Force and Navy. Like I was in the army for 4 years, and they shifted me. I was shifted to Air Force. So it's been 4 years for me now in Air Force, because when I got there was a vacancy in Air Force and they had to shift me. So that is how the shifting takes place.
So
So
like on how, like on what basis the shifting takes place, like what criterias and all?
like criteria is like, suppose if there are 100 seats, so the seats will be divided like 80 people should be in the army, 13 people should be in the navy, and 7 people should be in the Air Force. Suppose if there are 81 people in the army and there were only 6 people in the Air Force, which means one is short in Air Force and one is more in army. So obviously one person from army will be sent to Air Force. That is the criteria. Plus, suppose in the future, if your spouse or someone is from Navy or Air Force, then you can put up an application that so and so I want to get seconded, because suppose example, if you belong to South and all the naval units are in the southern part of the country, so you can put up your application asking for change of uniform to Navy. Then they will see whether the reason is genuine or not, and then provided there is vacancy in the Indian Navy, they will shift you to Indian Navy. But initially you will be getting commissioned to army, and you should put up at least 3 to 4 years of service, at least 4 years of service. Only then you can either change to Air Force or Navy.
Thank you, sir.
Yeah, welcome.
We have few more questions
Sir, please,
that
please, sir, please.
we'll take up. We have Dr. Muskan. I'll just allow her to talk.
Sir.
Muskan, you can unmute and ask your question.
Yes, sir. Sir, I was not there. Good evening, sir. Sorry. I
Yeah,
was
Muslim, tell me.
not there in the first half of the video lecture. So I was asking, what are the ranks that we will be able to get selected or get an interview for?
No, actually, there are no any set ranks every year. Like example, the number of vacancies 30 this year. So there will be 300 people called for the interview. So whoever has applied, top 300 will be selected for the interview
Okay, top 300
of the
in
NEET
the
rank.
of the NEET rank.
Yeah, among the people who have applied for the Army, this thing, Army Dental Corps. So there are no set cutoff ranks every year. So like it is always 10 times the vacancy or the amount, number of
And
seats available.
anyone can apply, and top 300 will be selected.
Yes, yes, yes. I
Okay.
think by this time merit list must be out. Sorry,
Hmm.
the interview list must be out by this time.
Okay.
Yes, yes,
Okay,
it is
sir.
out. Muskan is going to appear for the next exam in 26.
Okay,
So
okay,
just
sir.
to clear what Squadron Leader Joshua has told us, depending on how many seats are there, let's say next year there are just 10 vacancy. It's not necessarily top 300. Depending on how many vacancy are there into 10. Let's say next year there are 50 vacancy, into 10 is 500. If there are 10 vacancy, into 10 is 100. This top 100 rank is not rank 1 to rank 100, 1 to 100. It is top 100 people out of those who had applied. When you are filling the NEET MDS form, there is option of applying for Army Dental Corps. So let's say from rank 1 to rank 1000, there are 100 people who have applied for this post. So those 100 people will be called for the 10 vacancy. Okay, so
Yes, sir.
consider that.
Thank you,
Yes,
sir. Thank you
yes,
both.
sir, yes, rightly, sir, rightly said.
Yes, so we have Dr. Vidusri. Vidushi, sorry, who wants to ask. Vidushi, please ask your question.
Good evening, sir.
Yeah, good evening.
Sir, actually, I have been shortlisted for the interview, and my interview is on 11th November. So, I want to ask that when we'll enter the room, do we need to wish everybody sitting there in the panel separately, or we only need to wish to the center person there?
Center person.
Okay, sir. Okay.
You can just tell good morning. Please don't tell Jai Hind and everything. Please tell good morning, good afternoon, whatever it is. And then you
Yes.
should wish to the person who is sitting in the center of the panel. So he'll be the head or topmost person. So
Yes,
your
sir.
icon, your contact should be on him, and you should wish him directly.
Sir, I also want to ask that what is the weightage of the current affairs part, or how many questions will be there around it?
See, that's what there may or may not be a question. I'm just telling this thing, like what are parts you should be covered. Like they may ask even what happened on that day around 8 o'clock in Delhi. So it is not like that you will be able to read everything, you'll be able to answer everything. Just it is like normal in shorts news or normal general news which happens everywhere throughout the country.
Okay, sir. Okay. Thank you,
Yeah,
sir.
like example, if there's a flood in Chennai. So
Mm-hmm.
if you are from Chennai, they'll be asking definitely about that flood. Like if they want
Yes,
to
sir.
ask something about current affairs or whatever is happening.
Yes, sir.
So that is how they will they will basically try to plot you, or they will just try how good are you in asking or making the situation very simple. Their questions will be complicated, but it all depends on how you answer it or you simplify it and you give a very good answer. So that's why I tell, once the question is asked, take a pause for around 2 to 3 seconds and give a short and crisp answer.
Yes, sir.
Yeah.
So, like, I am from Chandwada, and recently there is the cough syrup tragedy occurred here. So, they may
Hmm.
ask around this also, na?
Yes, definitely. Yeah.
Yes, sir.
You
Okay, sir.
should know
Thank you.
something about that. You should know something about that.
Mm-hmm.
It is not like you should sit and read only about that for next 2 to 3 days. You should know
Yes,
something
sir.
about that so that they are aware that okay, she is aware about what is happening in the region,
Yes, sir.
because they will be
Yes, sir.
testing you in all aspects, not only dentist. Dentistry is just half. They can ask you. They can even ask you what is the meaning of your name.
Yes, sir. Yes, I got it, sir. Thank you so
Yeah.
much.
Okay, thank you. Next is Devendra. Devendra wants to ask a question. I am allowing him to talk.
So,
You can unmute and ask your question, Devendra.
Hello, good evening, sir.
Devendra, please.
I want to ask that is there any rule like we can get only PC only before 30 years of age, or like is there any age specific rule for PC?
Yeah. You are BDS or MDS?
BDS.
You're being a BDS, you are eligible to post permanent commission only till 30 years of age.
Okay, so
Like
I'm
suppose,
right.
yeah, please.
I'm right now 29, turning this year.
Hmm.
So if I get next year the ATC interview, so will I be able to get the PC or not?
No. Because example, when is your birthday? Like
15th
which
August.
month? Which month?
15th August.
So August, right? So if you get commission, like say next January, you are getting commissioned after selection,
Yes, sir.
and next August will be reaching 30, right?
Yes, sir.
So obviously, only after 2 years of service, you will be called for your permanent commission exam. So by the time you will
Okay.
be crossing 30 years of age. So you can't give your permanent commission exam, but yes, you can complete your 14 years of short service.
Okay. So if I appear for NEET MDs while being in the army,
You should get prior permission.
okay.
Because example, if you like say you have joined the army
Yes, sir.
and you have put in 3 years of service,
Yes, sir.
and then you have cleared your NEET exam and you came to know that you got a good rank and you're getting a good college.
Yes, sir.
At that time, you can't go and tell them that I need to leave army because I have given the exam.
Okay, sir.
Because you need to get permission first that you are going to appear so and so exam. So there is a certain policy to follow.
Okay, sir.
Yeah. But for the PC, for a BDS people, you can give permanent commission exam only till you are 30 years of age, and for MDS people, you can give a permanent commission till 35 years of age.
Okay, sir. So if I do MDS first and then go for ADC,
Yeah, still you will be out of age because you'll be 30 by August.
no, if I do MDS first, then for ADC, that will be before 35.
Yeah, that's what I'm telling. By example, if you are joining MDS this year,
Yes, sir.
you will be completing MDS when you are 33 years of age. Again, you should give your NEET MDS exam.
Okay, okay.
So there will
Okay,
be
sir.
you got my
Got
point,
it,
right?
sir. Got it, got it.
Yeah. So again, you should give your NEET MDS exam, and again you should wait for a year for this Army Dental Corps notification. So you'll be 34.
Okay, sir.
That is the issue. Yeah.
Thank you, sir.
Okay, yeah, thank you. We have a similar question what Sujay Singh has asked.
So
So he's saying that as my age is 42, what are the questions that may be asked? For example, why late? What will be the appropriate answer for this?
yes, sir. Yes, sir. There are officers who have joined in the age of 40, 42 also, sir. But so the maximum age is around 40 till 45 you can join. But the thing is, once you have joined, you will be only a short service officer, and maximum you can do service till 14 years of age. And yes, regarding questions, they'll be asking you what were you doing so far. Like once you finished BDS or MDS, until now, what were you doing so far, and why do you want to leave that part? And you have chosen army. Now the answer should be very genuine and a honest answer. Like we can't say that I was not like in that practice, so I come here. So definitely they will think that what will you do if you don't like army also. So the reasoning which you give for choosing army and also for leaving your present or the job which you are doing before. So that reason should be justified and should be convincing to them.
Few more questions before two raised hands are there, who asked previously.
So
There is one anonymous attendee who is asking what should be the BMI.
sir, BMI it is the same formula which is used to calculate the BMI, sir.
Okay, like what it should be within the ideal range,
Yes,
right?
sir, yes, within the ideal, sir. There is a range of five points, 5 units.
Yes, should be
So
within.
BMI should be within the range. And concession of around plus or minus 10 percentage in height is still allowed. The example
All
for
right.
my height is 178 and my authorized weight is 71. So I should be either 71 or less than 71. And if I am more than 71, up to 76 kgs it is allowed. So it is like more than 10%, they will still consider, sir. It
All
is
right.
not like even if you are 100 grams more, they will reject you. So even if you're 10% more, they will consider you, sir.
Got it. Okay, thank you. One more question asking about, is the fixed orthodontic treatment considered for medical fitness? If someone is having braces.
Sir, if someone is having braces, their occlusion should be good. There shouldn't be open bite or deep bite. And regarding dental, sir, there are different points given. So it is not like if you don't have a single molar, you will be rejected. So depending on the premolar or the number of teeth that is present, there are certain points that is given known as dental points. And you should cross the dental points, minimum points. The minimum points, maximum point is around 22. And minimum point required is out of 22 is 14. It is calculated based on the number of teeth that is present. So if you are having braces, suppose if they feel that your treatment is completed and if you want to remove the braces, you can remove it even after you clear your interview or your medical, because these all comes under temporary rejection. Just removing the braces portion only I'm talking about, because once you're having open bite
Yeah,
or closed bite, it is
cannot
difficult to
be
correct it
corrected
within
in.
42 days. Yeah.
Yeah.
So if they ask you to get the braces removed, it is easier to do within 42 days. So you can go ahead with braces. My suggestion is that don't remove braces just for this interview and this medical part, because you will, if everything goes good, it is good and well and good. But if something wrong happens, so then neither your ortho treatment or the interview will be completed. That is the issue. Yeah.
Okay. One more question. Do we get chance to place implants and implant-retent prosthesis? And they also want to know, Ankita also want to know, which system of implants are being used there.
Sir, implants, yes, sir. It depends on the interest which you want to learn or not. So definitely wherever you are posted, if you are in a field area, it is difficult. because there you will be doing only basic dental treatment or pain management, like emergency management. Implant will be happening in bigger centers where there are more than 4 to 5 offices, and definitely there will be a prosthodontist or a surgeon or a periodontist posted. So if you want to learn, you can learn through them. And in army, we have got around 6 to 7 systems in army. So we have got a wide range of systems available in army, which is commonly used in India.
One more question is asking about there is an anonymous attendee who has asked that how will be the interview if she tells that she is a mother of 18 months old baby.
Sir, first thing they'll be asking whether she'll be able to manage, because she won't be able to take her baby when she's posted in the field units. In field
Yes.
units, we are supposed to we go there and we will be in shelters. So she won't be able to take her baby over there, and then undergoing all the physical training and everything. So they'll be asking whether you will be able to manage your family life and as well as your professional life and as well as because once you join the army, you can't tell any excuse. Like you can't tell no for any duties whichever is given to you just because you are having a baby or anyway. Yes, they will be definitely consider only if it is a serious issue. So every time you can't be giving an excuse that I've got in the family or with the baby.
All right. One more question asking about uh, someone named GK has asked this, that what to prepare for the current affairs. Is the tie compulsory? Intro. Let me ask one by one.
So,
This question you already answered. What to prepare for current affairs, depending on which area they are staying and what all things are going on, they should know. This you already covered.
yes, sir.
Is asking, is tie compulsory?
Sir, actually, there is no any compulsory dress code, but since this is a very formal event, sir, so there are officers sitting in front of you. So when we go with tie and provided with a blazer in winter, so it will give a good formal look. So usually the way you appear or give the presentation, that is enough to judge the person actually. So you should be properly groomed and even your haircut, everything should be proper. So that is how the person's look itself will be reflecting their character and everything. So that is why I mentioned that the way you dress, the way you sit, the way you stand, the way you enter, and the way you greet others. So this will be your first impression before you take the chair. So tie is not compulsory. There are no any rules that you should go only with the tie. So I mentioned tie and so that they will think that this guy is properly prepared to look himself or show himself being better.
All right. Okay. Someone has asked if nasal septal deviation candidate can be eligible.
Sir, there are different grades for it, sir. So that grades are within it is with the ENT specialist. So you will be, ENT specialist will be examining you. So if it is beyond that particular grade, then you won't be considered. So if it is correctable, you will be temporarily rejected. Surgery will be done and you have to report back. If they feel it can't be corrected, then you will be permanently rejected. Because septal deviation is common to everyone. There will be slight septal deviation to all people.
Yeah.
So they have got separate grades. So only if they feel it is very severe and it can't be corrected, then you will be rejected.
Okay. There is question from an anonymous attendee who's saying they are a periodontist working in civil after MDS, 30 years old. Will this gap be acceptable? I guess this you already covered. Planning to appear next year because my husband is an infantry officer. Is this an acceptable reason to join?
Sir, yes, you can say that my husband is in army and even I want to join army. Yes, you can give your interview. There is no like barricade in that. You can go ahead with the interview.
There is one more question. There is someone who's asking that she wears hijab to cover her head. Is it allowed in the interview?
Yes, in the interview you can, but not during working hours. In the interview she can wear, sir.
Okay. So during working hours, I guess you said it should not be worn.
No, sir. But I would suggest if she is appearing for the interview, better not to go with the
All
hijabs.
right.
Shall I go through the question, sir, which is in the question and
You
session?
can see the questions. Now, yes, that would
Yeah.
be nice.
Yes, sir.
You
Yes,
can-
sir. Sir, regarding the intro, GK he has asked. So I'm starting from the first question,
Yes,
topmost, sir.
yes, please.
So intro can be as short as possible. I think 2 to 3 minutes is a long time. It should be within a minute. Like who you are, where you are from, what are your parents, and what are your hobbies, and where you have done your UG or PG. Only that much should be the interview, so that you are directing them to your portion. And then regarding preferences, no, there are no much preferences that will be given. Sepal deviation is answered. Yeah, for the eyesight, I think till -3 or -3.5 they will be considered. Beyond that, you will be rejected, and there should not be any LASIK surgery done in your eyes actually, because there will be a permanent scar on your retina, so it will be easier for them to identify it. So then you will be rejected. And then question regarding from, yes, if someone is doing government job on contract basis, is it necessary to take NOC? Actually, during the time of interview, it is not necessary. Once you clear the interview and before joining, then you should take an NOC from there, because all your documents will be with your current job. So you have to take a bona fide certificate or a NOC from there, saying that the particular candidates, that is your certificates is held with them, and you should take xerox of all the copies which you will be asked to show during the interview. I hope he has got my point. Yes, has asked regarding the NOC part, sir. I said, yes. Yeah, 31 years, I think you are eligible for SSC. You can eligible for SSC and also your completed PDS. So even after joining, you can even appear for your post this permanent commission exam. Because for MDS people who are completed, and if you join, the age limit for to appear for permanent commission is around 35. Only for BDS people it is still 30. Thalassemia, no. For girls, someone have asked about the shoes which they can wear. You can wear any formal ones, not very glittery or showy ones. There are some shoes known as the bell bottom shoes. So you can wear those shoes. So it will give a good formal look. CBCT, yeah, CBCT are there in many headquarters or bigger centers. It is there. So I think most of the questions are answered, sir.
Yes, most of the questions
If
that
there
you
are
asked.
further questions, I will be glad to answer, sir.
Yeah, there are two people who have raised their hand. If you can take those questions, I'll unmute them and I'll allow them to ask.
Yeah, please, sir.
Okay, so first, Aishwarya, please unmute and ask your question.
Yes, sir. Good evening, sir.
Yeah, good evening, please.
I wanted to know how long will the interview process go on for?
For a single candidate?
Yes.
It
Because
varies. Yeah.
my name is in the last of the list of the day, sir. So will my interview be cut short just because I'm in the last, or how will it be? I wanted to know.
No. It depends actually. Even in the last, you can perform well. It is not like being the last, they might ask very few questions and they will just reject you. It is not like that.
Oh.
They will assess each and every candidate with the same weightage. So, and also regarding the duration of the interview, it will vary between 5 to 10 minutes per person, and it has gone till 20 minutes also. So it all depends on how the way you answer the question and how they wanted to check your knowledge or level.
Okay, sir. Thank you, sir.
Yeah,
And
thank you.
another question, sir.
Yeah.
Are sports achievements and sports participation mandatory for selection?
No. It is not mandatory. It is just a hobby or an extra part. If they ask, you can tell, like district level or this thing. But concession and everything will be given only if you are represented at national level.
Okay, sir.
Yeah.
And another question, sir.
Yeah.
So after finishing the interview, when I leave the room, how should I end it? Should I just tell thank you, sir, or should I tell something else?
No. Just you can just say thank you.
Okay.
Place the chair wherever it was, and then just you can leave the room.
Okay, sir. And while entering also, it is just good morning, sir, to the person in the center.
Yeah.
Okay, sir. Yes, sir. Thank you, sir.
Yeah, welcome.
Yes, there are two more people who already asked the question,
Please,
but
sir.
let's allow them again.
Please, sir.
Vedika, you can ask your question.
Hello, sir.
Yeah.
Sir, if for any family reasons or personal reasons, the any SSC officer wishes to discontinue the bond, and in middle of the bond, can he or she discontinue within
Yes, you
that?
can. Yes, you can, but the reason should be very genuine.
Okay.
Yeah, because the reason should not be like you have got seat in this thing, or the reason should be very genuine that you are leaving because of a very serious family issue or personal issue, whatever it is. So only then they'll be considering it to release you from service.
Okay, sir.
Because considering you have been selected and you are taken in, then if you opt out, so it is a loss to the entire organization. And plus,
Okay.
if this was done before, then some other candidate would have been benefited, right? So that is the reason getting released is not easy.
Okay, sir.
Yeah.
Thank you, sir, for answering all my questions.
Yeah. Thank you. Welcome.
Okay, last question for the day. Muskan wants to ask.
Sure.
Muskan, you can unmute and ask now.
Yes, thank you, sir. Sir, I've undergone LASIK, but my scar is not that visible. So, will there be a problem? Should I have to disclose
When was
to
it
them?
done?
Sir, 2 years ago, it was contura. So the scar is not that visible. So if you see and you do not know I have undergone LASIK, you won't know. So do I have to disclose it to them, or
If they ask, you can say yes.
will that be a deal breaker?
See, actually, here only army doctors and specialists will be examining you. So, particularly like for septum and everything, ENT people, for eye ophthalm people, so there will be different specialists looking after you. Okay.
So it depends
So,
on them if they're able to
yeah. So
detect or not.
it is like, yeah. So there might be a scar, and there might, suppose if they are rejecting you, it can be either permanent or temporary also. So if it is temporary, you can go to the nearest military hospital or wherever the higher center is, and you can get your fitness done there.
Okay.
Okay, so this is always specialty based. So I can't judge more on what author people will be giving
Exactly. I was
opinion.
just
Yeah.
you mentioned LASIK, so I was
Yeah.
asking.
But usually people have done lashes before, like before they go to the interview.
Oh, that's a problem. I have done way back. Okay.
Yeah. That's the problem. Yeah.
Okay. Thank you so much, sir.
Yeah. Most welcome. Here, someone have asked about tattoo. So if you're having tattoo, generally in the army, all the exposed areas of the uniform should not be tattooed. So it is like basically the neck area, below the elbow area, that those should not be tattooed. So I would recommend or suggest you to wear a full hand so that your tattoo is covered up. For at least for the at least for the interview process, you can just appear with it. Sir.
Okay, I guess all of the questions are covered. I can still see. Let's allow Aishwarya to answer. I can see her hands raised, and she told that she is appearing for interview this time.
Okay,
So
sir.
we'll take her as a last question.
Please, sir.
Yes, Aishwarya.
So for this short service commission, you told it can be extended up to 14 years. So is that 14 years service mandatory, or after 5 years should we give an exam and then it continues?
No, there are no exams after that. It is like
Oh.
automatic. Only if people who wants to leave after 5 years, they needs to put up an application, or else your service gets extended. Sorry, suppose if you have finished 5 years,
Hmm.
and if you want to leave service after 5 years, then you have to put up an application. If not, your service will be extended to 9 years. And again, further, if you want to leave, you can leave in 9 years. If not, it will be extended till 14 years.
Okay, sir. Yes, sir. Thank you, sir.
Yeah.
Okay. Can we take one more question? There is
Sir,
Dr.
please,
S.
please, no issues.
Yes, Dr. S. Please ask your question. You'll have to unmute yourself and ask. I guess we are not able to hear you.
Hello.
I guess there is some problem with them.
Sorry.
Irfana wants to ask a question. Yes, Irfana, please unmute and ask your question.
Good evening, sir.
Yeah, good evening.
So I need to ask about actually I'm wearing spectacles. So I need to ask about the power of the
What is-
specs that you have
what is
already
your power?
mentioned, I think. So my power is minus 2.2 in one eye and minus 2 in one eye.
Yeah, you can go ahead. Even mine is the same. You can go ahead.
Okay. Thank you so much, sir.
Yeah,
Thank
yeah.
you so much.
Okay. Vedika, you want to ask a question or was your hand raised previously only? Okay, I guess
No,
there
sir.
are...
I have already
All right.
asked.
All right. Yes. So I guess that's all for this wonderful session. Thank you very much, Dr. Joshua, for this session. I'm sure all
most
of
welcome, sir.
those who attended it have their doubts cleared. They have a better idea now about the Army Dental Corps. Many of them, as we saw, are going to appear for this year for interview itself. So best of luck to them. Let's wish them that they join there. More and more students from APIRE MDS go and join Army Dental Corps as their passion is, just like you have done.
Yes, sir.
And yeah, let's hope that in future also we can conduct some kind of session like this for
Sir, sir.
other students if they want to ask any
Sir,
doubts.
sir, sir. And everyone, please free to ask any personal doubts or whatever you have. I would request sir you can share my number with them, sir.
Yeah.
So any doubts you can take in the name of APIRE MDS. Just leave me a message. I would be glad to correct your personal doubts or whatever in the sense. Even after you get selected or if you don't get selected, whatever it is, I'll be there to help you. No issues.
Yes, in past also for many of our students who are going for this interview, Dr. Joshua has helped them. So if anyone of you wants to ask anything personally to him, please contact me. I'll share, as he has given permission, I'll share his number. Please, I'll he has not asked for it, but I'll request, don't call, just leave him a message. He'll reply you because he'll also have a busy schedule there. So that much we can do for him.
Yes, sir.
Right?
Yes, sir. Definitely.
Yeah. Okay, so I guess we'll conclude the session here. The students who maybe joined from in between, who are not able to go through the full session, its recording will be available on app. You can go through it later. And yeah, that's all. Thank you very much again, Dr. Joshua.
So thank you
We'll
so much,
conclude
sir.
the
And
session here. Yeah.
all the best to all the candidates who are appearing. Please be confident, stay calm, be bold, have a good night's sleep, have your breakfast, and appear. Good, always good will follow you. So all the best for all the very best for the interview in Delhi.
Thank you, Dr. Joshua. Yeah.
Sir, thank you so much, sir.
Yes.
Bye, sir.
Bye.